Okay, let's unpack this. Get ready for a deep dive into something you probably didn't expect to link up: your everyday bathroom habits and, believe it or not, your cardiovascular health.
Hmm.
Sounds a bit odd, I know. But the material we're looking at suggests what happens in, well, that very private space can actually give some pretty significant clues.
Hmm.
Clues about your blood pressure, circulation, maybe even risks like stroke. So, this deep dive is really for you if you like connecting those unexpected dots and getting straight to the point.
Right, without getting bogged down.
Exactly. Our mission today: to pull out the key signals your body might be sending from the bathroom and understand why paying attention could be a shortcut to better health awareness.
It really is one of those connections that sort of makes you go, hmm. I mean, think about it. Your cardiovascular system pumps blood everywhere,
Mm-hmm.
including, the digestive and urinary systems. So it kind of makes sense that changes there could signal pressure on the heart or blood vessels.
It's like the body whispering.
Exactly, sometimes just a whisper. And the question is, are we listening?
That's it. So here's where it gets really interesting. We're going to look at how specific things like uh, straining, how often you go, urine color, even just how long you sit there,
Uh-huh.
how these might be sending quiet messages about blood pressure, circulation, all those underlying factors.
So what does this all mean for you listening?
Well, it means we're about to uncover some practical knowledge from this material, unexpected stuff you can use right away. Let's jump in with maybe the most direct one: straining, particularly, during a bowel movement.
Yeah, this is a really crucial one the material highlights. When you strain hard, forcefully on the toilet, it can cause this temporary, but sometimes pretty significant spike in blood pressure.
Okay.
For a lot of people, maybe that's not a huge issue now and then.
Yeah.
But if you already have high blood pressure, hypertension, or some heart disease,
Then it's different.
then that temporary spike can actually be quite dangerous. The material points to increased risks, serious stuff like stroke, heart attack, even just fainting.
Wow. Okay.
So it really emphasizes, if constipation is a regular thing for you, don't just ignore it. Simple lifestyle changes are suggested,
Like what?
like getting more fiber in your diet, making sure you're drinking enough water,
Hydration, always key.
always. And honestly, just moving your body more. Physical activity helps things move more naturally, reducing that need to strain.
Makes sense. Tackle the cause to avoid the risk. Okay, so straining's one signal. What about urination patterns? You mentioned frequency, especially like at night.
Yeah. Another surprising connection in the material: frequent urination, particularly nocturia that's getting up often at night to pee,
Uh-huh.
that can sometimes be linked to things like poor blood flow, high blood pressure, maybe even early signs of heart failure.
Really? How does that work?
Well, the thinking is, if your kidneys aren't getting the best blood flow during the day when you're up and about, they might sort of catch up and process more fluid when you lie down at night. Blood flow shifts then, you see. The main takeaway here is just to notice if it's a pattern for you. If it's happening regularly, it's a signal worth bringing up with your doctor.
Definitely not something I would immediately connected. Okay, sticking with urine. The material also mentioned color, just simple urine color.
Yep, it's actually a really handy, right there indicator of your hydration status.
Okay.
And hydration directly impacts your blood volume, how easily your blood flows, which of course affects blood pressure.
So dark urine means.
If it's consistently dark yellow or amber, that's a pretty clear sign you're dehydrated.
And dehydration.
Hmm.
What does that do to the heart and circulation?
Well, when you're low on fluids, your blood volume drops, and your blood can actually become a bit thicker.
Right.
So your heart has to work harder to pump that thicker blood around your body. That extra effort, it can raise your blood pressure.
Which is obviously a concern if you already have issues.
Especially then, yeah. So the goal mentioned is simple. Aim for pale yellow urine. That's usually a good sign you're well hydrated.
Good visual cue. So staying hydrated isn't just about thirst, it's directly helping your heart. Now, here's one that might make people shift a bit, but it's in the material: sitting for too long, even on the toilet.
Yeah, the source material doesn't pull punches here. It points out that lingering for a long time on the toilet, maybe you're scrolling on your phone, reading.
We've all probably done it.
Right. It still counts as sedentary time. And we know prolonged sitting anywhere contributes to poor circulation. It ups the risk of blood clots.
Mm-hmm.
And over time, it can contribute to rising blood pressure.
So the takeaway there is pretty straightforward.
Be efficient. Use the bathroom for its purpose. Then get up and get moving again. Make sure your day has regular activity, Break up those sitting spells. Your toilet time shouldn't be your main sedentary block.
Huh, good point. A simple but, yeah, important adjustment. Okay, so beyond these patterns, the material also listed some specific warning signs. Things related to bathroom habits you should definitely talk to a doctor about.
Absolutely. The material is clear on these. You should definitely consult a healthcare professional if you experience uh, things like
Okay.
any real pain or significant pressure while using the bathroom, feeling lightheaded or dizzy after a bowel movement,
Mm,
noticing swelling in your legs or feet that can tie into fluid balance and heart function,
right.
seeing any blood in your urine or stool, that's always a flag.
Always.
Or, like we discussed, a significant increase in urination frequency, especially if it's waking you up multiple times a night.
Got it.
These, according to the insights, could be more urgent signals. Maybe cardiovascular strain, kidney issues, internal pressure problems. Things worth checking out.
Those definitely sound like things you shouldn't ignore. It really drives home that the body does give us cues, if we're listening. So, to bring it all together practically, what are the recommended healthy bathroom habits for supporting heart health based on this material?
Yeah, it summarizes some key actionable things. Pretty straightforward, really.
Yeah.
Prioritize drinking enough water. We keep coming back to that.
Crucial.
Eat plenty of fiber-rich foods. That helps promote regularity, easy movements, less straining.
Makes sense.
Stay physically active overall. Movement helps everything. Circulation, digestion.
Uh-huh.
When you feel the urge to pee, go. Don't hold it in unnecessarily.
Right.
And finally, kind of the bookend to the straining point, don't rush, but also don't linger.
Be efficient.
Be efficient. The ideal routine described is one that feels natural, comfortable,
Mm-hmm.
not strained, not stressful, not excessively long.
That paints a really clear picture, natural function. And for anyone wanting to dig even deeper into this link between habits and blood pressure specifically, the material mentioned a resource.
Yes, it referenced a book, Lowering High Blood Pressure Naturally by Dale Ruddock. Seems like a place to find more of these kinds of real-life strategies and facts on how, small daily habits can really impact blood pressure.
Good to know. So as we kind of wrap up this deep dive, the core idea that really stands out is how our bodies are constantly communicating. Often in subtle ways, right? And sometimes from, well, unexpected places like the bathroom.
Exactly. Your body's always talking. These habits we just went through, they can be those quiet signals, those whispers about your heart health.
So let's try not to ignore them. Paying attention, making those small tweaks, hydration, fiber, movement, being efficient in there,
Yeah.
these are small, manageable steps you can take
Every single day.
every day. And they add up to actively protecting your health. It's actually pretty powerful, isn't it? How much info our bodies hold just waiting for us to tune in.
And what's fascinating is how gaining this kind of awareness can shift your perspective entirely.
Absolutely. It really makes you wonder, doesn't it? What other whispers might our bodies be sending us in other unexpected moments throughout the day? If only we trained ourselves to pay closer attention.
Mm.
How could that awareness change how we view even our most mundane routines? Something to think about until our next deep dive.